The top health official in Africa says they're in panic mode over an outbreak of a rare Ebola strain, one with no approved vaccines, treatments, or even a specific diagnostic test. The earliest case officials have managed to trace was a healthcare worker in Bunia, a city in the Democratic Republic of the Congo. While they died in hospital in late April, the actual outbreak wouldn't be detected for more than a week. By the time the World Health Organization was alerted, 50 people had already been killed. As of Monday, that's gone up to 88. There's now more than 300 suspected cases, but that delay in detection plus the ongoing conflict in the region has made contact tracing extraordinarily difficult, meaning the actual number of cases is suspected to be way bigger. To make matters worse, this is a bundibujo outbreak. There's actually 4 different viruses that can cause Ebola in humans, and bundibujo is one of the rarest, meaning treatments are extremely limited.
Currently, I'm on panic mode because people are dying. I don't have medicines, I don't have vaccine.
Ebola is spread via bodily fluids like blood or vomit, which luckily does mean it's far less transmissible than, say, COVID or the measles. Unfortunately, it's also way more deadly. There's only been 2 previous bundibujo outbreaks, but it killed between 30 and 50% of all those infected, and it's especially dangerous in areas without well-resourced health facilities, which is certainly the case for this region of the DRC, which has been subjected to years of violent conflicts over its mineral supplies. Now, the Africa Centre for Disease Control says they are in talks with companies to see if there are any early development treatments, diagnostic tests or vaccines that could be safely trialled during this outbreak, but that is still weeks away. Without a vaccine, infection control usually means quarantining all of those affected in medical treatment centres to limit the spread. But in the past, militias have purposefully targeted medical centres, likely making people even more reluctant to admit to symptoms or seek help as they are fearing for their lives. Not to mention the widespread distrust of both the DRC government and international Ebola treatment teams in general. And finally, the huge mining industry in the region means massive population movement. People are constantly coming and going, including to and from nearby countries. There's already been 2 confirmed cases in Uganda and at least 1 in the DRC city of Goma.
Western countries, they don't understand that when Africa is affected, they are also at risk because people are flying every day.
The World Health Organization says the outbreak doesn't currently meet the criteria of a pandemic, but they have declared a public health emergency of international concern. And they're convening a formal emergency committee to corral support and resources for that affected region, where even basic infection control supplies like gloves are already running low.